Hello friends, today we are going to discuss about the liver. Liver is the largest gland in the body and it is also known as hepar. It is reddish brown in color, soft in consistency, and in males it weighs about 1600 gram and in females it weighs about 1300 gram. So we can discuss it is all about introduction. It is the largest gland in the body. It is also known as hepar. It is the reddish brown in color, soft in consistency. In males, it weighs about 1600 gram and in females, it weighs 1300 gram. Then we are going to discuss about its location, where it locates. Before that, we had a diagram. This is the abdominal part and this is the umbilical region. So we can divide these into 9 portions or 9 quadrants. This is the first quadrant. It is called right hypochondrium. It is called right hypochondrium. This is called left hypochondrium. This is epigastric region. So this is all about next 6 quadrant is not needed for this liver. So liver occupies the whole part of the right hypochondrium, greater part of the epigastric and small portion of the left hypochondrium. So where it occupies, its location, it occupies the whole portion of the right hypochondrium, greater part of the epigastric region and only a small portion of the left hypochondrium. It is a wedge-shaped structure. Liver is a wedge-shaped structure. Wedge-shaped structure. It is having 5 surfaces. How can we remember that 5 surfaces? By these words Paris. Paris means A, P means posterior, A means anterior, R means right, I means inferior and S means superior. So this is the surfaces of the liver. Then we are going to deal about the lobes of the liver. There are 2 lobes. Liver is having 2 lobes, right lobe and left lobe. Here we had 2 pictures. This is the anterior view, which means the front view. This is the back view of the liver. Then in the front portion, the right lobe and the left lobe are divided into 2 lobes by a ligament called ligamentum, falciform ligament. So there is a ligament in the front portion or anteriorly. The right and the left lobe is divided by a ligament called falciform ligament. In the posterior portion, we are having a whole structure. In the back view, at the posterior surface, we are having a ligament called ligamentum venosum and inferiorly we are having ligamentum teres. So right lobe, left lobe. Then we are going to deeply into the 2 lobes of liver. First one is the right lobe. Right lobe is the largest lobe and it occupies the 5/6 portion of the liver and it is further having 2 lobes. What are they? Caudate lobe and quadrate lobe. Caudate lobe. Then we are going to discuss more about the caudate lobe and its relation. Caudate lobe, we can see it is situated at the posterior surface. And it is bounded at the right side by the inferior vena cava and its left side it is having ligamentum venosum and its inferior portion we are having porta hepatis. So caudate lobe and quadrate lobe is there. In caudate lobe, its right side is the inferior vena cava and its left side is the ligamentum venosum. and its inferiorly we are having porta hepatis. Then we are having another lobe called quadrate lobe. Quadrate lobe. Quadrate lobe. In quadrate lobe, its right side is the fossa gallbladder, fossa for the gallbladder, and its left side is having the ligamentum teres. This is all about the quadrate lobe. Then there is a small portion here. We are having a porta hepatis. What is this porta hepatis? Porta hepatis is a deep transverse, we know that it is transverse fissure which is about 5 centimeter length, and it separates the two quadrate and caudate lobe. So we can also say that it lies in between the quadrate lobe and caudate lobe. Then the portal vein, hepatic artery and hepatic nerve enter into the liver through this porta hepatis. So what are they? Three veins. Portal vein. First portal vein. Second hepatic artery. Third one is hepatic vein enter into the liver through this porta hepatis. So these are all about the right lobe. Then we are going to discuss about left lobe. Only small 1/6 portion of that liver. It is smaller than the right lobe and near the fissure for the ligamentum venosum. Near the fissure for the ligamentum venosum, its inferior surface presents a rounded elevation. It is having a rounded elevation where near the fissure for the ligamentum venosum, its inferior surface presents a rounded elevation called omental tuberosity. Omental tuberosity. So, near the fissure for the ligamentum venosum, its inferior surface presents a rounded elevation called omental tuberosity. Then, next we are going to discuss about its arterial supply. What is its arterial supply? By looking into this picture, we can clearly define the arterial supply of the liver. Liver receives 20% by the hepatic artery and 80% by the portal vein before entering to the liver. By considering this is the liver, portion of the liver, before entering to the liver, that hepatic artery as well as the portal vein is divided into right and left. After entering to the liver, it is further divided into segmental veins, then further divided into interlobular veins, then its ramification. What do you mean by ramification? Ramification means unites. It unites to form what? Sinusoids. Ramification of interlobar vessel gives sinusoids. These are all about the arterial supply of liver. 20% of it supplied by the hepatic artery, then 80% of it supplied by the portal vein. Then before entering to the liver, it is divided into right and left. After entering to the liver, it is again divided into segmental vessels, then again divided into interlobar vessels, then unites to form sinusoids. Then we are going to discuss about the venous drainage. Venous drainage. Hepatic sinusoid, it is just a reverse. Hepatic sinusoids then moves to interlobar veins, then moves to sublobular veins that unites to form hepatic veins. So, hepatic sinusoids unites to form interlobar veins into sublobar veins unites to form the hepatic veins. Hepatic veins, upper group is there, lower group is there. Then, upper group is having only 3 branches, right, middle and left. Right, left and middle. Then lower group is having a various number of small veins. Then it unites into inferior vena cava. So this is all about the venous drainage. Then we are going to discuss about what its relations. Superiorly, anteriorly, inferiorly, how it's superiorly and anteriorly. Superior of the liver we are having diaphragm and anterior abdominal wall. Inferiorly we can see a diagram over here. Liver, this is all about liver. This is the liver. Inferiorly we are having a stomach. So this picture can stomach, then having a bile duct is there, bile duct, then duodenum, then here we having a fissure called a hepatic fissure of colon. Colon is transverse colon, ascending colon, descending colon is there. In between we are having two fissures, hepatic fissure and next fissure is there. First, in the inferior surface of the liver we are having the hepatic fissure, that is the hepatic fissure of the colon, then duodenum, stomach and then the bile duct. This is the inferior relation of the liver. Then we are having posterior relation. Posteriorly we are having esophagus, inferior vena cava, aorta, gallbladder, vertebral column and diaphragm. Then it's laterally we have lower ribs and diaphragm. These are all about its relation. So we discussed first about introduction. What is its introduction of the liver? It is the largest gland in the body. It is also called hepar. It is reddish brown in color, soft in consistency, and in males it weighs about 1600 gram and in females it weighs about 1300 gram. And its location, it occupies a whole portion of the right hypochondrium, greater part of the epigastrium and a small portion of left hypochondrium. It is wedge shaped and it is having 5 surfaces: posterior, anterior, right, inferior and superior. Then we discussed about the lobes, right lobe and left lobe. We discussed about the front view, that is a ligamentum, falciform ligament. Then we discussed we had the back view of the liver. We discussed about the right lobe, left lobe. In the right lobe we had 2 lobes, caudate lobe and quadrate lobe. Then discussed about the relations. Then we had the arterial supply. We discussed about arterial supply. Then we go through the venous drainage and then we move into the relations: superior, anterior relation, inferior relation, posterior relation, and last one is lateral relation. These are all about the liver, which is the largest gland in our body.